This video will demonstrate why teaching clients how to better manage their internal pressure can be important for improving their pain, strength, or range of motion. I'll present the two opposite ends of the spectrum, the first being a client that isn't able to generate sufficient internal pressure. These clients are typically very tall, thin, lanky. They can demonstrate an excessive range of motion. Think maybe stereotypical yoga practitioner. On the opposite end of the spectrum is someone who has a difficult time overcoming their internal pressure. These clients are typically of shorter, wider stature, very stiff, rigid. Think stereotypical powerlifter presentation. Going back to the first, the client that has a difficult time generating sufficient internal pressure. If I let a little bit of air out of this bottle, you'll notice that it's very compliant to shape change. It can bend and twist in any which direction. Just a common example of what we see with clients who maybe have a difficult time generating sufficient internal pressure is an increase in thoracic kyphosis, an increased curvature of the mid and upper back. So they're in this forward flex posture. What the typical therapy prescription is for these people is to strengthen the muscles in the mid and upper back to essentially pull the client more upright. While best case scenario, this might prevent the person from flexing forward, we haven't stabilized the system in any other direction, and I think we missed the boat in regards to the potential cause of that forward flexed posture in the first place. So with the appropriate selection of exercise, position, and breathing technique, we can teach an individual to better pressurize from the inside out. And you'll notice now the bottle is much more resistant to shape change, and it's in a more upright position. This improved position putting the limbs in a little bit better position to operate. On the converse, think if so this is going to the individual who has a difficult time overcoming their internal pressure. Think if I stuck an air compressor in this bottle and blew it up until it was about ready to pop. That bottle then would be very, very resistant to any type of shape change. Its movement options would be very limited. So that can result in the same tissues getting loaded over and over and over again, a potential pain generator in this case. So with this client, again, with the appropriate selection of position, exercise, and breathing technique, can teach them how to decrease their internal pressures, which will allow them to display more movement options. So that is just one way, that's just a couple examples of how teaching clients to better manage their internal pressures could correlate to improvements in pain, strength, or range of motion.